Good morning, everyone. Welcome back into North Dakota today. The 2023 Tribal Maternal, Child, and Infant Health Symposium is taking place at the Avalon Event Center next week. Vanessa and Michaelin are joining me on the couch to give us all of the details of this informative event. Welcome, you two.
Thank you.
Yes, thank you so much for being here. So what is really the goal of this event?
The goal is to bring awareness on infant mortality for American Indian people. Our infant mortality rates are significantly higher than the non-native population, so it's really to talk about and uplift our Indigenous mothers and children and families, and talk about how we can reduce our infant mortality rates.
Wonderful. So what is the theme for this year?
It's reflecting on our past and shaping our future.
So why that theme for this event?
We basically wanted to think about the context of historical trauma, underlying causes that may have stemmed from history of different types of medical practices after colonization. Yeah.
Wonderful. So it's a 2-day event and it's jam-packed with events, correct?
Yes, we have some great speakers lined up. We have Dr. Denise Lajmadir, who is our keynote speaker, and she's going to talk about boarding school impacts on our youth and families. We have Dr. Julie Smith, and she's going to talk about...
She's going to be talking about some of the community health aspects and involving Indigenous traditional practices with maternal and child health care.
And we also have a fatherhood panel. We are all about uplifting our fathers and our families with the Maternal Child Health Symposium. And so our fatherhood panel is going to feature local fathers and grandfathers who are Indigenous and from the community to talk about their experiences.
So who would you really recommend to attend this event?
I would say nurses, practitioners, everybody in the healthcare field that work with Indigenous populations and in maternal and child health in general. But we do want upcoming medical professionals to attend to just kind of feel out what this field might be like if they're interested in going into this field as they're continuing their education as well.
So how many years has this event been going on?
This has been going on for 9 years.
Wow.
We've hosted this event. And normally it's in tribal communities hosted by tribal nations in North Dakota. And this year we thought we would bring it to Fargo.
Wonderful. So why the transition? Are you trying to reach a broader audience, or what's the really goal with that?
Trying to reach a broader audience, bringing some of our stakeholders and collaborators to the Fargo-Moorhead area, visit our campus at NDSU, and really just see some of the great work that's happening within our community here.
So you said the location has switched off of, tribal land to Fargo. How else has this event evolved over the past 9 years?
I think it's really gotten larger. We've gotten more support. We collaborate with the North Dakota Department of Health and Human Services, so they've been instrumental in helping us promote this event, keeping it going for the past 9 years, and hoping that we can keep it going for 9 more years and into the future.
Absolutely. So when and where is this event?
So this event will be November 8th through the 9th, taking place at the Avalon Event Center in Fargo.
And then how can folks get tickets if they're interested?
It is free. It's we have an Eventbrite link, and you can find that link on our website. If you Google the American Indian Public Health Resource Center, it can be found there.
Wonderful. And why would you really recommend people to come out to this event?
I would recommend people to come out to learn more about Indigenous public health, infant mortality, and maternal child health, what people are doing out in the community to address our concerns with that.
Wonderful. Well, thank you both so much for joining me and telling us about this topic.
Thank you. Thank you for having us.
Yes, of course. All right, everyone, stick around. Coming up on today's show, we have your daily dose of motivation.